Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and thanks so much for joining us in the Sunflower House for this podcast where I am going to be interviewing our graduating Specialized Women's Health Fellow, Dr. Alexa Fiffick. And she is a highly regarded physician. She's board certified in family medicine, and she just finished her 2-year fellowship in Specialized Women's Health and is graduating. We had a wonderful graduation ceremony for her where her family was there and our speaking and Specialized Women's Health team was there. She took her final exit Specialized Women's Health test yesterday and passed it with flying colors. So let me tell you a little bit about her. She received her bachelor's degree in sociology from Case Western Reserve University here in Cleveland. And then she went on to pursue a master's of biomedical sciences at the Commonwealth Medical College. And then she went on to earn her medical degree from the Alabama College of Osteopathic Medicine. She then completed a 3-year residency in family medicine at Doctors Hospital in Columbus, where she focused on primary care and pediatrics, women's health, and geriatric care. Her passion for women's health inspired her to come to the Cleveland Clinic and complete a 2-year Specialized Women's Health Fellowship, where she received comprehensive training in areas of menopause, perimenopause, hormone therapy, sexual dysfunction, vulvar disorders, high-risk breast cancer patients. She's an active member of several professional organizations, such as the North America Menopause Society, now renamed the Menopause Society, the International Society for the Study of Women's Health, Sexual Health, ISWISH, and the American Board of Family Physicians. She's very committed to staying up to date with all the latest in medical research and treatment options for patients to empower them to be strong, be healthy, and be in charge. And we're going to talk about her future. I was hoping she was going to join me as a partner in the Center for Specialized Women's Health and help run the Specialized Women's Health Fellowship, where we have 2 new physicians starting later this summer. But she is going out into the brave new world of direct primary care and concierge healthcare. And we're going to talk about that as well. So welcome, Dr. Fiffick, to the Sunflower House.
Thank you. Thank you for having me, and thank you for that glowing introduction.
Well, you've done a fabulous job over these last 2 years. And do you want to talk a little bit about the highlight of your training or how you decided to pursue this? Because it's an extra 2 years before you start to work to pay off all of your school loans and all of the debt that you've incurred and will be incurring.
Yeah, so I always tell the story that when I was a medical student, I had a really hard time deciding what I was interested in. And my main interest always was women's health, except when you go into medical school, as many of our listeners and you know very well, it's really, really limited to just reproductive potential and catching babies, having some surgeries, and then moving on. And I was interested in obstetrics and gynecology until I realized that that's about where that stops. And ended up kind of shifting gears to family medicine, knowing that I could specialize in a fellowship in women's health, and found my way to the Cleveland Clinic, actually feeling like this was always the place that I belonged in medicine, as I didn't really fit into true just plain family medicine or true plain obstetrics and gynecology. Turns out I found out exactly where I belonged at the Specialized Women's Health Fellowship, because it really did such a good job of training me for all the other aspects of women's health that are so frequently ignored, not only by general, the general population, but still even by our medical schools and our residencies. And this fellowship has been It's very one of a kind. I cannot say that when I was searching for opportunities, such as the Specialized Women's Health Fellowship, that anything came close to what this program offered and what Dr. Thacker offered. And I feel so honored to have gotten the opportunity to learn with our excellent staff at the Cleveland Clinic, because it's been life-changing for me, and ideally that means it's going to be life-changing for my patients.
Wow. So what were some of the areas that you focused on, and some of the activities and honors and things that you were involved in the fellowship?
Yeah, so one of my main focuses during fellowship was on my research with high-risk breast cancer previvors. So looking at BRCA1 and 2 carriers and how that interplays with their experience of surgical menopause. And this is a really big passion point for me, knowing that there are so many women out there that still are not as well informed or not as well cared for as I would hope they would be, and I'm sure that you would hope they would be, because there's still such little education regarding what early surgical menopause does to women. And so often we get these patients in their 30s, 40s that are in early surgical menopause, and their world is turned completely upside down. And really, really making a point to understand what that is pathophysiologically and emotionally for these patients has been a really interesting point of my fellowship and of my ongoing research right now. Along with that, one of the really essential portions of my fellowship has been the Cleveland Clinic and Mayo Health combined clinical breast training program. I did about an extra 49 credit hours of live and recorded courses with experts from all around the country, including Dr. Holly Peterson here at the Cleveland Clinic, as well as a ton of great clinicians in the Mayo Clinic Institute, as well as other institutes, all from medical breast like Dr. Peterson, breast oncology, radiation oncology, as well as radiology, the people who read the images, and really getting an understanding of what these patients are needing as part of their care and where the gaps are.
And you also were involved in a lot of education of physicians, of nurses, of lay women. You got involved with Let's All Talk Menopause, and you've done events that we have available to view on speakingofwomenshealth.com. And
yeah, it's been a definite passion of mine that Dr. Thacker has fostered a lot, and it's one of the really good qualities about the program that I don't think exists a lot in medical education is how to communicate with your peers and how to communicate with your patients. Because the goal of really taking care of these patients and making a difference is not only to change one patient's life at a time, but to follow the goals that Speaking of Women's Health has always followed about, empowering those patients, empowering them to not only advocate that for themselves, but for other people, and to ask questions to their clinicians about the conditions that they're struggling with, and being able to be someone who is not only given opportunities to educate patients on how to advocate for themselves and their friends and sisters and mothers, but also how to advocate in a way that helps clinicians help our patients. Because as we all know, women's health is very much an area of need within the medical system. And until both patients and clinicians alike really rally together, we're not going to be able to make a change. So being able to communicate with both groups is very, very, it's an honor to me, honestly.
And you also authored several columns on speaking of women's health, from noisy knees and arthritis to vitamin D, which got a lot of attention, importantly, to high-risk breast cancer patients and other topics. Any comments on that experience and those health tips?
Yeah, so doing those columns, I think, was a very good jump point for turning the type of communicating that I was taught to do in residency and medical school into a way that is able to disseminate knowledge to the average patient, even some clinicians. I think that being able to communicate about things of interest, like my favorite vitamin D, and it should be everyone's favorite, but that's my bias, is that I really was grateful for the opportunity to be able to communicate things that I was passionate about in a forum that reaches patients. And I still stand by a lot of my recommendations, especially from that vitamin D column. And in fact, we are getting more data that the recommended goal of about that 45 to 55 as a blood level, that our goal may actually be too low for some things, especially since we see so many women in the perimenopause and menopause with hair loss and fatigue. We really know now that that is maybe not even enough, and we may need to be aiming for more like 75.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Wow. So I just recently did a podcast around Father's Day that hair loss is not just for dear old dad. And you certainly have fabulous hair. So what is your secret besides genetics?
Yeah, a lot of genetics. I take my vitamin D. I make sure that I eat well-rounded. And one of the things that I think gets missed a lot, especially in patients that are in their reproductive years or perimenopause, is iron deficiency. Iron deficiency gets missed a lot because our body is very good at compensating to make our hemoglobin, the level that we call anemic, stable. But I like to make the kind of comparison that it's sort of like trying to make sure the shelves at Costco are stocked when the back, stock isn't there. If you don't have a really good ferritin and iron level, you're not going to be able to keep putting product on the shelf. And there's going to come a point where that hemoglobin eventually ends up depleting and you see the anemia. But prior to that, a lot of women walk around iron deficient and really should have that checked by their physician, because it can play a giant role in hair loss and hair kind of turnover.
That was actually the topic of my first podcast, iron, and what women need to know about iron, because it is very important for females on several levels, and women have iron losses throughout their life, and it remains one of our more popular podcasts.
I can see why.
You have so much expertise in high-risk cancer patients, known breast cancer patients just at risk for breast and ovarian cancer. Any tips? I mean, we can certainly have you back on in October, which is Breast Cancer Awareness Month. I'm going to plan to maybe have my geneticist son on, and maybe Dr. Peterson, who's really been a trailblazer in the field of medical breast as a specialty, which a lot of our fellows, some more than others, have gotten extra exposure to. So any pearls of wisdom?
Yeah, one of my big takeaways from that education portion of the fellowship is that we are not doing a good enough job of understanding, as not only the physicians, but as the patients, what our own personal history means from a risk perspective, because everyone takes into the consideration, well, on my mom's side, there's breast cancer, but there's none on my dad's, or some other misunderstandings that a BRCA diagnosis means 100% risk of cancer. So really understanding your own personal history and communicating that with your physician is super important. I think we do a poor job of getting patients screened early in their 20s and 30s, when really the big differences can be made to find out what the family history and potential genetics are. So really advocating for yourself. And I know that our average patient population is more of the perimenopause, menopause, postmenopausal age group, but you don't get there overnight. You have to live a full life full of risk factors prior to that. And knowing those things when you're 20, 25, 30 are crucial. In addition to that, I think we overlook the capacity that alcohol and obesity has on cancer risk. And one of the major takeaways that I got from the courses, especially if you take a look at people's careers who have focused on a less traditional entrance into breast care, like Dr. Dam Musalam, who is more, really takes a holistic lifestyle approach to it. About 30% of new breast cancers each year are attributable to obesity alone, meaning there's no genetic predisposition, there's no other risk factors. The only risk factor is the stress that the obesity, inflammatory, chemicals cause on the breast. And I think being very aware of both your genetic risks as well as your lifestyle risks is crucial to living a healthy life.
And I think a lot of people, when you ask them about what illnesses run in their family, and certainly environmental exposures might include people that you spend time with that are not genetic, but we really mean the biological relatives. And it's interesting because increasingly people are finding out about relatives that they're related to that they didn't even know through all the 23andMe. Do you have any comments about people who go and have that 23andMe or Ancestry or other, like over-the-counter, off-the-shelf, non-physician, non-geneticist directed testings, and what some of the pitfalls of that might be?
Yeah, so the number one pitfall that immediately comes to my mind with that question is that a lot of patients, I'll say, hey, you have this extensive family history of these cancers, you're really high risk. Have you ever been referred to genetics? And they're like, oh no, I did 23andMe and it said I was BRCA negative. I go, okay, so that's not good enough. It only tests for 2 different types of the BRCA1 and 2 genes, the most common, but you're really ruling out a ton of other genetic risk factors if you're doing panel testing with a well-respected, physician-approved order for a full panel of genetic testing. And the other thing that comes to mind too is that people say, oh, well, I had it back in, 2012 or 2010, and it was good back then. Same thing, kind of commentary-wise. Prior to 2013, we didn't have access, at least in our institute, to full panel testing. So getting your testing updated and making sure you're getting physician-approved testing is really, really crucial before you kind of rely on those results.
And
now,
also,
if you find out,
I thought the 23andMe for BRCA testing was only valid in people that were Ashkenazi Jewish descent.
So it only tests for the 2 strains that are from Ashkenazi Jewish ancestry, but that rules out a few other mutations within the BRCA genes themselves.
And you were mentioning the risk that obesity has on breast cancer, but also several other cancers, cardiovascular disease and diabetes. And you've certainly had extra training in obesity medicine. And I know you've helped a lot of people, a lot of our patients in that regard, because that is such a pressing need. And, the old, just eat a little less and exercise a little more is very important, but it's not enough for a lot of people.
Yeah, it's not that easy. And we get so many patients that come in the perimenopause and menopause that are complaining of weight gain or inability to lose weight. And it is so much more complex than people understand. Yes, the adage of calories in, calories out, being that your calories out are higher, does apply to the purpose of weight loss, but there's much more complex science going on behind it. For example, in perimenopause and menopause, the hormone fluctuations and the estrogen deficiency really play a big role in weight gain or inability to lose weight. In addition to that, we're playing the roles with ghrelin and leptin and a whole slew of other chemical messengers that really get quite stressed out by obesity, causing those signals. And obesity really in and of itself should be considered its own disease because it's nuanced. Not everything works the same for every patient, and we're coming out with new amazing medical tools every single day. But we need to keep talking about it because until it becomes much more streamlined in our education to physicians as well as menopause and perimenopause, obviously, the more physicians and clinicians that we have educated about it, the more we can get help for these patients and the more we can advocate for them, especially with things like insurance companies and government.
Yeah, and that's always such a big issue in terms of any therapies, including like the new exciting therapy that you and I have been following with fezolinetant, which is going to be marketed as Veoza, a non-hormonal option for hot flashes, and certainly our women with blood clots and cancers that are estrogen receptor positive, who are undergoing active therapy, many times cannot receive menopausal hormone therapy. They're very exciting advances, but the whole cost issue and coverage issue is really a big deal.
Yeah, I meant to tell you yesterday, I just got my first patient on Veoza yesterday.
Oh, that's great. And it's 45 milligrams daily, and then you're going to check the liver functions every 3 months for the first 9 months because it's metabolized through the liver. And there are other drug interactions, which hopefully we'll be getting information and a list on so that we can be alert. And I really think it's so important that patients, if they come prepared to their visit, where they have their records, they bring in their medications, the actual bottles or boxes or however it is being dispensed, as well as their supplements too. I just think that helps us take better care of patients. And I know that's your passion, taking care of patients. And that's part of the reason why you didn't want to go with a traditional employed situation, because you wanted more time to explore these complex issues with your patients. So tell us how you came to that decision.
Yeah, so it's pretty much on the nose with what Dr. Thacker just said, where I feel like the current healthcare system doesn't allow for physicians and patients to really have the interaction and relationship that we need to do a good job. Just like Dr. Thacker said about knowing all of your medications, knowing your history, coming prepared with documents and bags of medications and supplements, I still can't get through that in 15 minutes. And I can't do that when you have a complex history of heart disease, diabetes, a slew of other things. And I really chose to go towards this concierge model of medicine so that I could choose to have longer visits with my patients and give them more direct care. All of the outcomes that I have experienced through my career where I felt like I was making a big difference and I felt like the patient was making significant progress both from a health perspective, but on a personal level, always came when I felt like I was really involved and that person and I were making the decisions together. So going this concierge model, so it's really a traditional physician-patient relationship was my goal. And it always has been, and there's been some really amazing mentors along the way that have made it happen in the context of the current system. Like Dr. Thacker is one of the most thorough physicians that I've ever met in my entire life. And she's always been exceptionally impressive, but I want something different for myself and something different for my patients. And I think that a lot of patients are ready for it. I think they see the flaws in our system and know that our hands are often tied by things that have nothing to do with us or them. And I really wanted to be able to set those things aside as much as possible and give the care that patients deserve.
Well, it was very poignant at your graduation because everyone that was there included people that had worked with you, colleagues, nurses, support staff, family, people in training. We had just such a diversity of backgrounds of people that were there to celebrate your graduation, and everyone had something nice to say or some story to recount. And I didn't realize that one of the persons there, which isn't surprising because we all take care of each other, was a patient of yours. And she said, "You saved my life."
We'll be back after a quick break.
Have you ever experienced fitness failure? You know, you set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
Yeah, that was surprising, but I get that, because when I met her, she felt like so many of our other women that a lot of her concerns were being pushed to the side, or that she was more complex than the 10-minute visit with her physician allowed. And it was something I had to push through with her over the course of multiple visits to really get to what I thought the couple root problems were with her health. And once we broke past those barriers, we thought, great, we have a great plan. We had to jump through a bazillion hoops with insurance to get her the medications she needed. And that was exceptionally eye-opening for me, because here's somebody who works in healthcare, who works for this giant institute, and she is still victim to the same issues that every other patient is and has, especially as women. And I thought it was so humbling and touching that she felt that way, because as a physician, I'm sure you also always feel like, man, I'm trying really hard. I'm trying so hard to get her what she needs and to help her. And I just feel like I'm on a treadmill and I'm not going anywhere. So it was amazing to me that with the effort that we put in, that she really saw that and felt that.
Yeah, well, I've certainly spent a lot of my personal time and dime doing advocacy work for physicians and patients in terms of healthcare costs, specifically related to the cost of money and the middlemen, the pharmacy benefit managers, and why insulin, which only costs pennies to make, is sometimes outside of people's reach. And there have been, people who've died because they're parsing out their medicines. And a lot of my patients have taught me about it, especially some of the patients on governmental insurance, Medicare, that I have to ration my drugs or I can't buy food. So, you have to help me organize that. And so we certainly have so many resources on speakingofwomenshealth.com. And I did a podcast on how to save money on medicines. And we've had several of our nurses contribute, and they spend most of their whole day many times doing prior authorizations. So since you're going to go into this direct primary care and cash-based concierge care, where you're getting the middlemen, the insurance companies, all of that stuff out of the exam room, so it's just you and the patient working together with shared decision-making, which is certainly desired and optional. How are you going to handle some of these expensive biological drugs, or these drugs that do require a lot of paperwork or insurance hassling?
Yeah. So unfortunately, that's one of the main things that there is no real workaround for yet. When we talk about the concierge model, what you're really getting is the office time with the physician, as well as some of the labs and other imaging. But there aren't I don't believe there are a ton of great workarounds for medication costs. I think that's one of our nation's biggest downfalls right now, is that regardless of which method you use to get it, whether you're going on GoodRx or the old Canada Drug website, using the Mark Cuban website, Cost Plus, or some of our specialty pharmacies that apply coupons, there are still a lot of hoops to jump through. And so myself and my staff are still going to need to do that. Luckily for me, I was well equipped in fellowship with Dr. Thacker on how to investigate these different coupon methods or specialty pharmacies. And it's a hot topic in pretty much all of my lectures. I just gave a grand rounds at one of the other local hospital systems, and that was like 3 in a row, like right off the press, like, you said you got it on this other website. My patients have been paying $100, and I'm like, no, it should be like 20 for a month if you go to the right place. And I think I think that's definitely someplace that one of my passions lie in advocacy, as well as how women are treated in the workplace, especially in menopause and perimenopause, and how that trickles down to motherhood. But I wish there was a better answer, but I still have to work around it just the same as you do.
Now, are there options for, I know it varies by state law. I know some direct primary care practices will purchase medicines directly, much cheaper.
Yes.
And even though you're not a pharmacist and you can't dispense, you can still prescribe. How is that in the state of Ohio?
Yeah, so in the state of Ohio, a concierge or DPC practice can get licensure in order to purchase medications and label them just like a small pharmacy would, which often comes with a significant discount. So that's definitely something I'm looking into for my patients, especially for a lot of very common medications and very cheap medications. As Dr. Thacker always said, things like estradiol and progesterone are very cheap at their baseline, but what we really end up paying for along the way is the middlemen. So trying to cut that cost and bring some cheap generic options into my office it's on my list of to-dos. I'm working through the licensure right now.
Excellent. And I think that having patients be consumers, like before you buy a car or you purchase anything, people, do price comparisons. And in healthcare, since so many people have employer-based healthcare, it kind of takes that aspect. So if you're not responsible for the quality or the cost on either side, it's kind of just like, when other people spend your money, like the government spends our tax dollars. I don't think there's quite the same attention that if it's our money, are we getting the right value for it? And I think that people do need to be aware of different price differentials, not just with medications, but also like imaging tests, lab tests, things like that.
Mm-hmm. Yeah, because if you traditionally order, for example, vitamin D, and it goes through your insurance doesn't agree with Dr. Thacker, I put on as the code for the reason we ordered it. I've had patients who, despite a history of vitamin D deficiency, osteoporosis, osteopenia, a slew of other things, that makes a ton of sense for me to check it. They say, no, it was normal last time, being that it was like 30 or 31, and they decline it and cause the patient to receive a $250 bill. That is an actual quote from a patient of mine, the $250 number. But even other things like the CBC, CMPs that we order all the time, just for an annual visit, I know that sometimes patients, insurances tell them, hey, that's covered, and they still end up paying $30 or $50. Well, it turns out an actual CBC for a lot of these cash price labs, if you don't run it through insurance, are like $5 or $8. So it can be significantly more affordable, unfortunately, even if you have great insurance, to go outside of your insurance to price shop. And that applies to things like x-rays, CTs, MRIs as well. So I think the world of concierge and DPC care is very exciting because it really gives you insight into an alternative option for how things can be done.
Mm-hmm. And so tell us how people can contact you. How can they reach you? What's your social media, website? What kind of events are you going to be doing to promote your practice?
Yeah, so my company is going to be called Concierge Medicine of Westlake, here in Westlake, Ohio, on the west side of Cleveland. That was a lot of wests. And right now, if you go to mymsmedicine.com, you can find our landing page and learn a little bit more about myself and the practice, as well as sign up for a meet and greet with myself to see if I'm the right fit for you with my sort of approach to medicine and approach to our relationship. So that's at mymsmedicine.com, mymsmedicine.com. It also has my phone number on there that you can call and speak to some of my schedulers and patient relationship advocates at 440-797-1871. We're going to be located on Center Ridge Road in Westlake, on the back side of the back entrance to St. John West Shore. So if you're familiar with where the Stella Mia restaurant is, which has very good food, in case you did not know.
I didn't.
It's we're pretty much next door to them. They make very, very, very good stuffed peppers. So that's my shout out. And their Italian wedding soup is very good.
Oh, we have a great Italian wedding soup recipe, by the way, on speakingofwomenshealth.com. It's one of my favorite recipes on the website.
And to any listeners that may not know, my husband loves to cook. It's so funny because he'll look at the recipes on the Speaking of Women's Health website and gets really excited. He's like, "Oh, I could do that. Oh, we use those things. Like we have those things in our house." And I'm like, "Yes, we do." It's so funny that you're taking cooking tips from my boss, and we're actually getting more vegetables that way.
Oh, good. Well, he'll have to contribute some of his own recipes because he's quite a chef in his own right. So we should be able to feature some of his recipes.
Yeah, some of my favorite ones of his are coming up for fall. He does these amazing stuffed acorn squash, like meat and veg things, which are amazing. So maybe I'll be able to grab him for early fall for that. And if you want to get in contact with me directly, you're not so interested in going to the website just yet, you can catch me at Dr. Fiffick at msmedicine.com is my email. That's F as in Frank, F as in Frank, ICK.
So you said Fiffick as in terrific.
Correct. Yeah, Fiffick is in terrific.
What about Instagram? Do you have Instagram?
Instagram, yeah. We have a Concierge Medicine of Westlake Instagram. I also have a personal Dr. Fiffick Instagram handle, and we're also on Facebook. We haven't branched out a ton beyond that onto TikTok or some of the other sites just yet.
How about LinkedIn? You should do LinkedIn.
But we're on LinkedIn, and if you haven't seen it yet, Dr. Thacker, I posted the carpet that we were pulling at the new office. It is about the same color as this dress that I'm wearing.
Wow.
So if you're excited to see what that renovation looks like, which is very entertaining in my opinion, a lot of fun colors, a lot of wallpaper, you can head over to the Concierge Medicine of Westlake social media.
Oh, that sounds like great fun. Will you be doing any, so will most of your practice be membership, DPC? Will you do just any cash-based consults, or are you going to do any telemedicine? Are you thinking about getting licenses in any other states? Will you do some remote work?
Mm-hmm. So kind of yes to all the above. Right now, I only have a license in the state of Ohio. However, both from a concierge membership model for primary care as well as women's health only care, I'll be offering in-person and telehealth through Concierge Medicine of Westlake. I also am accepting referrals purely for women's health care and hormone health in the region. So I will take all of the above. I am looking to expanding and getting a few more medical licenses so that I can do some telehealth and help. As we know, not every state has access to great menopausal and hormone experts like we do here in Ohio with Dr. Thacker in the Cleveland region and quite a few others throughout the Dayton and Cincinnati area. There's a lot of regions in the country that are super underserved from a midlife women's health perspective, and I plan to make a difference there too.
And some of the procedures that you're competent in and that you're going to be offering?
Yeah, so people, as soon as I say women's health only sort of membership, people immediately think just like pap smear and breast exam. But really I offer all sorts of contraception, IUDs, biopsies, other skin procedures for pre-malignancy or malignancy biopsies as well. So pretty well rounded from a women's health and general family medicine perspective.
Boy, that's fabulous. Well, thank you so much, Dr. Fiffick, for joining us in the Sunflower House, and hopefully you'll come back and we'll put some of that contact information in the show notes. I'm your host, Dr. Holly Thacker, who's the Executive Director of Speaking of Women's Health, and I am the Fellowship Director of our Specialized Women's Health Fellowship, which I've been running for over a quarter of a century. And Dr. Fiffick is our latest graduate, and we have 2 more excellent new physicians that will be joining us this summer. And please, if you don't already subscribe to our podcast, please subscribe anywhere that you get a podcast. We're also on Rumble, speakingofwomenshealth.com. You can go on Speaking of Women's Health and press the donate button because we're a nonprofit. And we want you to be strong, be healthy, and be in charge. And our incredible congratulations to Dr. Alexa Fiffick, who's terrific.